today the discussion is on the role of rather recommendations of dietary modifications in diabetes. That's a very valid point today. We know nearly about 9 to 10% of Indian population has diabetes. We have, as on date, around 77 to 80 million diabetic patients, and it will cross 100 million in 2030. That is the calculation of WHO. Why we are worried about diabetes, I always used to say to doctors, we are not worried about the blood sugar, but we are worried about the complications. Because all of us know diabetes is a metabolic vascular disease. Metabolic component is glycemia. Vascular component is taking your life out or making your life or shortening your life. Micro and macro vascular complications. To reduce that, we need a good adequate control of diabetes. That the HbA1c must be below 6. There are any number of studies all of us know. And there are many ways to control the diabetes. We are seeing today every patient in nearly 45, 47 years. I feel people are on oral hypoglycemic agents. People say that they are walking every day, 3 kilometers, 4 kilometers. We have added some insulins also, and even up to the extent of the latest insulins. But still their blood sugar is not getting controlled, especially postprandial. When you sit some time with them and find out the problem is dietary management. When dietary management is controlled adequately, we bring his blood sugar level under control, number one. And now there is a recent study, or there are any number of studies. They have said that diabetes reversal can be done. Patient is diabetes, if it is less than 10 years, and with a diet and exercise, we will be able to revert diabetes. Reversal or remission of diabetes has been come. To that extent, diet plays a key role in the management of diabetes, in its control, in its prevention of complications, as well as mortality and morbidity. Therefore, this topic is very, very important. We would like to hear from our dietary expert, Dr. Meenakshi. What is her view on the role of diet in the control of diabetes and in the prevention of vascular complications? We would like to hear her view. She has done a lot of work on that. We would like to hear your expert views, Dr. Meenakshi.
Sir, when we talk of pre-diabetes and diabetes as well as the control of complications, first and foremost, there are several methods of, if somebody is a pre-diabetic, to reverse the pre-diabetic status to a non-diabetic status itself. It is possible. I have seen in my practice, though the textbooks and recommendations says that 12 weeks is more than enough if you follow medical nutrition therapy and lifestyle modifications. In 12 weeks, you can sort of reverse from pre-diabetic to non-diabetic status. But in practice, we have seen at least 6 months. If you lose weight from 7 to 10% of your present body weight and make slight modifications in your present dietary pattern, you can definitely reverse from the pre-diabetic to the non-diabetic status. So I would say nutrition is a very, very powerful clinical and therapeutic tool, both in prevention, management, as well as delay of complications. So we've seen whether it's type 1 or type 2 diabetes, you can bring down the HbA1c to as high as 2% just with medical nutrition therapy. I think that's, just by making a small tweak. Say, for example, if somebody is eating, I simply tell somebody, if somebody is overweight and is risk of diabetic because of a very strong family history, or has recently had COVID, or has been on steroids, or there could be a list of risk factors for that particular person to become a diabetic, I would simply say, reduce one cereal exchange. It's difficult when I say the word cereal exchange. Not everybody may understand cereal exchange. If I say you're eating 4 idlis or 4 chapatis for breakfast, just bring down 1 chapati or 1 idli or 1 dosa. In the afternoon, whatever you're eating, suppose you're eating 2 pulkas, you pull out the 2 pulkas from the major meal which you're consuming. Or if you're consuming rice, 1 portion of rice, just 1 handful of rice. If you replace it with 1 handful of vegetable, a simple change, not a very, very difficult change, and reduce the sugar consumption, reduce the accompaniments when it comes to the fried snacking. Dinner, you have an early dinner, if possible. If you're not a diabetic, just 1 fruit salad, vegetable soup, and a glass of milk, early dinner, and you've reduced 500 calories from your present calorie intake. Along with that, you step up your activity just by about half an hour to 45 minutes. Believe me, you lose 4 kgs per month. And it's not difficult a task to reverse your pre-diabetic to non-diabetic, or to prevent, just bring down your insulin resistance and improve your insulin sensitivity. Safeguard your beta cells. I would simply say that is one important message. Second thing is maternal malnutrition. It's very, 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 very important. I think of late we've been talking of transgenerational risk of non-communicable diseases. If we are having a malnourished mother, that itself, iron deficiency anemia, is a marker of insulin resistance. That can further generate a low birth weight infant with fewer neurons, fewer nephrons, fewer beta cells. So the cascade of events is on, and suddenly the child is being pushed to too much of calories because the child was born low birth weight. Mother is very anxious. She wants the child to gain weight very, very fast, and she's pushing to excessive calories, wherein, you're pushing too much of calories for somebody who's born with fewer beta cells. And importance of B12 and folic acid. People push folic acid during pregnancy, not realizing that there is B12 deficiency. If it is existing, then you are going to go push the YY hypothesis or Dr. Yagnik's hypothesis, wherein you are going to push the transgenerational risk of non-communicable diseases. So it's important to tackle maternal malnutrition. And third thing, if you have already walked into diabetes, you know that you are walked into diabetes, you need to look into the social determinants of health, which people forget. People look into the anthropometry, biochemical, clinical, dietary pattern, but they forget the social determinants, whether they have access to the right food choices, whether they understand numbers. Do they understand HbA1c 7%? Do they understand that? Do they understand fasting blood sugar 126? We have to make them literate on that level also. So these little things all put together make an ocean of knowledge for somebody either to prevent diabetes or to manage diabetes. And some people say, it's okay if I'm going to eat one piece of sweet. My sugars are doing fairly well. They forget something called glycemic variability. They have to be taught on glycemic variability. They have to be shown the mirror of their blood glucose levels for them to understand, yes, when I eat rice flakes, puffed rice flakes, so the understanding is rice and rice flakes are different. Puffed rice flakes is light. It's not fried. So it may not be having a very high impact on your postprandial blood glucose. But when you put an AGP, ambulatory glucose profile, on them and show it to them that today you have eaten a banana, look at your blood glucose. Today you've had tender coconut water, look at your blood glucose. Today you've had pongal, look at your blood glucose. Today you've had chapati or broken wheat rava upma, look at the difference in the blood glucose. And explain to them how it influences to worsen retinopathy, nephropathy, and neuropathy. I simply tell them, if one of you walked into retinopathy or nephropathy or neuropathy, it's a simple walk to Venkatachalapati. It's unfortunate to link it like that, but that's how we say that it's a ticket to heaven. So you start now. Don't wait for the complications to walk in. And I personally feel a pre-diabetic is more at risk. I think you are a legend in understanding and teaching us this, that they're at more risk of cardiovascular complications than somebody who's been treated with, anti-diabetic agents. So pre-diabetes is a stage which we need to cut and nip at the bud.
Thank you so much. You have very well explained how a doctor should act in the pre-diabetic state of the patient. And you have rightly highlighted the value of patient education. One is doctor education, second is patient education. How to make the patient comply to your dietary, guidelines. Unless he is made to understand he has taken this because of that sugar is high. And unless he understands that, he will listen to you only for a shorter time. Beyond that, he will not listen to you. That you have really brought it out. Now there are many components in the diet, as all of us know that. One is a calorie, another is how much of carbohydrate, fat, and then cholesterol, proteins, and then macro, micronutrients, and water. So many components are there. In diabetics, we all know that calorie has to be restricted, especially in a patient who is a little obese. And when you want to reduce the calorie, there are low calorie diets, very low calorie diets, like that we have a lot of entities. When you want to reduce the calorie, from which component of the diet you want to reduce, carbohydrate, how much, and protein, fat, if you can put it across, doctors who are youth can definitely understand that. Kindly go ahead.
What I would say is, first of all, we have to understand carbohydrate. People think carbohydrate is present only in rice. Even the dal has carbohydrate. Even the milk has carbohydrate. Obviously, everybody understands that fruits have carbohydrates, but the difference between the two types of carbohydrate, complex and simple, first understanding is that. And second understanding in fiber, which type of fiber will help us? Is it the soluble fiber which is going to help us, or the insoluble fiber? Now, if I'm going to talk of fiber, everybody is aware that ICMR tells us we need 20 grams of fiber per 1,000 calories. If it is American Diabetes Association, it tells us 14 grams per 1,000 calories. But how do you get that 14 grams? Or they say the higher is 25 grams per 2,000 calories which you're consuming. Now, first and foremost, we need to understand that if I am to get, say, suppose 25 grams of fiber in my diet on daily basis, which will help me prevent or help my postprandial blood glucose under control. How do I get it? Say simple 100 grams of beans. It will give me 9 grams of fiber. So half my battle is won. So there is in fact a recent diet, I do not know if you've heard of, which is known as the Blue Zone diet. In Blue Zone diet, they have found throughout the world, there are 5 regions which are having population who are living more than 100 years of age with not suffering from cardiovascular disease, dementia, Alzheimer's, cancer, diabetes. The mortality rate is low. There are a number of centenarians who are very, very high in these 5 regions in the world. What sort of diet are they following? They are following something called the Blue Zone diet. The Blue Zone diet is, I would say it's a capsule. You know, we've been talking of the Mediterranean diet, the My Plate, the pyramid, a healthy diet, a balanced diet. I would say it's all in a single capsule called the Blue Zone diet, wherein they say you retreat from meat. What I mean by saying retreat from meat, move away from red meat. What is red meat? Is going to give us saturated fat. It is a source of saturated fat, which in turn is going to increase make my gut unhealthy. When my gut is unhealthy, it is a mother of non-communicable diseases. That is point number 1. So I retreat from meat, reduce the red meat consumption. Second is I reduce the whole fat dairy, whether it's whole fat cheese or whole fat milk. I bring it to skimmed milk. Now, do I need to buy skimmed milk, pay a lot of money and buy skimmed milk? Not required. You buy the milk, boil it, keep it overnight in the fridge, remove the layer of cream next morning, and then use the milk. So you are having skimmed milk. Third thing, reduce the sugar as much as possible. How in elderly people or middle-aged people, where are we consuming so much sugar directly? We are consuming it in the form of tea, coffee, in the form of carbonated beverages, in the form of fruit juices. So pull out the fruit juices, replace it with fruit. Avoid carbonated beverages. Any sensible person, anybody who has little bit of knowledge, he need not be educated also. Will he drink 8 to 12 teaspoons of sugar mixed in a glass of colored water? No. If you explain this to a person, that a glass of colored water with flavor and some taste, which is having 8 to 12 teaspoons of sugar, will you drink it? Definitely no. If you explain this, he is not going to drink. So cut down on the sugar. Most important, cut down on the number of teas and coffees you're consuming. People are consuming due to stress. IT industry is having this vending machine, which is continuously offering them tea, coffee. Tea, coffee is not the worry. Every time you're drinking a cup of tea, coffee, a vending machine specially provides 1 to 2 teaspoons of sugar. Suppose you're taking 4 cups of tea, coffee, 8 teaspoons of sugar is just coming from the tea, coffee. How can you reduce it? You reduce the size of the cup which you're using to drink the tea and coffee. So that you have the happiness that you have consumed the 4 cups, but actually you've not consumed 4 cups, you've consumed only 2 cups. That is the first thing. Next, you choose only on plant-based diet. Today's world, I think whether it's climatic change or it is global warming or it is gut health, anything and everything boils down to plant-based diet. So 95% go plant-based. Then we talk of choose on fish. Obviously, if you're a vegetarian, you're not going to choose on fish. You can choose on flax seeds, you can choose on fenugreek seeds, you can choose on green leafy vegetables, you can choose on whole grams, you can choose on walnuts for your omega-3. So basically, I was talking of when it comes to cholesterol, it depends on patients, individuals' biochemical status as well as cardiac status, wherein we need to reduce the cholesterol or no. But according to the Blue Zone diet, it talks of 3 whole eggs per week. So in case the patient has even more requirement of restriction of cholesterol, then we may have to, leave it only to egg whites. So that's one important thing. Then go wholly whole. In other words, choose on foods which are not processed. That's very, very important. And apart from that, two other things are, as I was talking, if you consume 100 grams of beans a day, you get 9 grams of fiber. If you consume one fruit, just one guava, you get 9 grams of fiber. You consume just 100 grams of onion or 100 grams of tomato, you get 2 to 2.5 grams of fiber. So 5 plus 18, you've already made your 23 to 24 grams of fiber per day just with 100 grams of tomato, onion, cucumber, one guava, and some amount of beans. So this alone is enough to meet your fiber requirement. Apart from that, you're going to eat vegetable, you're going to have some whole grams, you're going to have some whole grains. So that alone adds on to your fiber intake. Apart from that, at least replace one snack of your day with a handful of nuts, which means when you talk of nuts, you can talk of, 1 ounce of, I would say 1 serving of nuts, which be 12 to 14 almonds. 12 to 14 almonds, or you can take about 3 whole walnuts or 6 split walnuts, or 12 to 14, you can have pistachios. Pistachios can be larger in number when compared to almonds. So 1 handful of nuts, they should not be fried or salted nuts. And last but not the least, as I mentioned to you previously, a half cup of beans. It can be French beans, it can be broad beans, it can be any form of beans which need to walk into our diet. So we should spend time on chewing our food. We need to nourish our body and cells, which comes with chewing, not with gulping down. Another important message which I want to share here is the rule of 80. What is the rule of 80? You eat only 80% full, not 100% stomach. Eat an early dinner. Remember to have a vegetable for dinner. At least in South India, most people consume either an idli or a dosa with some, sambar or some chutney in the night. They very rarely consume vegetable for dinner. In North, at least, thankfully, with chapati, there is sabzi and dal. But at least in South, we should insist to have a nice big bowl of vegetables for dinner, which helps to reduce the hepatic glucose output and helps to improve the fasting blood glucose. So these are certain important things. And most importantly, the beverage has to be water, buttermilk, clear soup, vegetable soup, and not as much wine or alcohol. How much ever we may talk that red wine has got flavonoids, polyphenols, it is cardiac friendly. Choose on 2 drinks for men and 1 drink for a lady. I think it's better to keep away from alcohol as much as possible. Though I think you are an expert in telling me with its cardiovascular benefits, I think I leave it to you, sir, with that.
Thank you so much. You have very nicely touched upon the centenarians. Centenarians are always close to my heart. The Japanese group of people.
And the Okinawa people, they consume a lot of sweet potatoes and a lot of ladies' finger, a lot of spices which you and me consume.
A lot of books they have written. I read, I give it to many other doctor colleagues as a gift also. How they live for 100 years and super centenarians. See, it is basically a mental relaxation and diet. And basically they focus on diets. And you have focused so well on the calories, on the fibers, on the carbohydrates, and the lipid side. All of them have to be balanced. I always endorse your statement, whether it is small or large, or a high concentrated liquor or a wine, or for daytime or nighttime, or cardiac benefit, no cardiac benefits, always say no to alcohol. That is my statement. Especially in a developing nation, nobody sticks to the limit. We don't stick to the limit of children. We don't stick to the limit of speeds. We don't stick to the limit of food, and we don't stick to alcohol. And another thing I always used to stress in diet is, in South India, there is a culture called as Paratha culture. We have done a lot of studies and presented also. One paratha has got 2000 calories. Your one day food, it has. Everybody eats 5 parathas. I have written an article in a newspaper. A paratha culture will make the entire country diabetic. And you go to a North Indian side.
I agree, sir.
There is a type of naan, butter naan, which is almost equivalent to that, has got lot of calories, which we enjoy, relish, and take it as a healthy food. No. These are the changes that has to come into the minds of the doctors, which they will have to convey to their patients, so that we will be able to reduce the incidence of diabetes and control diabetes and reduce the incidence of vascular complications also. a few, remarks we would like to hear from you. The dietary choices or the advices for patients with diabetes in a few systemic diseases. For example, the commonest complication we see in a diabetes is a cardiovascular disease. For that patient, what dietary, a patient has got an acute myocardial infarction, he has been thrombolized, has taken to the cath lab, and angio has been done, and a stent has been put in, he goes home. At that stage, he will be sent to you for your dietary advice. What you would like to strictly advise him?
See, basically, when the patient has a recent angio, first thing is I want to save his kidney. People may laugh at me, but then I tell the patient you follow a diet, meaning I talk to my interns and tell them we need to tell the patient, assuming the patient is third stage to fifth stage diabetic nephropathy. The patient is not having diabetic nephropathy, but we have insulted the kidney because of the diet. So you assume that the patient is in the third stage to fifth stage of nephropathy, though he is not in that stage. Assume it because he's had an angio and he's been referred to us. He's having a time gap of 1 to 2 weeks for his bypass surgery. So I will tell them to reduce the salt. That is the first important thing.
Sir, welcome Dr. Chandrakant Pandav.
Thank you very much. Shukriya. Thank you very much.
The Padma Shri awardee, we greet you and we want your good wishes to be bestowed on all of us. So nice to see you, sir. And your brother was talking about your long fight. I was telling him I am also fighting for 15 years. I'll get the blessings of Chandrakant and get blessed. Thank you so much, sir. Nice to see you. Nice to see you, sir.
We are old friends, Dr. Sundaram. I met you earlier also.
Yeah, I think when I saw the picture, I have met you, but I could not recollect probably long years. When I come to Delhi, I'll see you, sir. You are in Delhi, isn't it?
I'm based in Delhi.
Okay. When I come there, I'll definitely catch up with you, sir.
Delhi, Dilwala ka shahar hai, Dilwala ka shahar hai, Delhi.
Sir, we our nutritionist and me were discussing on the medical nutrition therapy in diabetes. Since you are involved in that basic concepts of nutrition, now I would like to evaluate from you what the government is doing to control the NCD. Now there are a lot of funds being allocated, for the preventive side of it, especially newer NCD centers they are starting. Lot of fund is going there, lot of manpower is being put in there, and what they are trying to do, sir, because NCD is a epidemic. Unless we control it, the entire economy of the condition will go down, sir. Lot of wellness centers have been started only for prevention. In that, what do you feel the government should do that, and what the government is doing, sir?
I think the first message from our community to the government is NCD is a pandemic. It's not an epidemic.
Yeah,
it's a pandemic. And we have done a lot many things on pandemic of COVID-19. Now, important thing about pandemic, as you know, 75% of deaths are caused due to non-communicable disease. NCD causes 75% of deaths.
Yes.
That's number one.
Yeah.
Number two, health and wellness center. I'm so happy that the government has started these centers. But I still feel that the people still continue to focus on curative part. As you know, Dr. Sundaram, there are three types of prevention. Primary prevention, secondary prevention, and tertiary prevention. We seem to focus a lot on tertiary prevention. We only say that prevention is better than cure. We only give lip service to that. But in practice, we don't do that at all. I think the main thing is that we must understand that diabetes should not be taken in isolation. We should take it as a lifestyle disorders, which contribute to hypertension, cardiovascular diseases, diabetes, asthma, stress. All these factors need to be taken into consideration. So don't take diabetes in silo. Don't take it in isolation.
Okay.
It's a complex disease caused by a number of entities. That's the second clarification we should have. The third thing is there is a lot of misinformation, disinformation, distorted information, incomplete information. So I think as a country, we should have a standardized operating procedures for having a very nice package of health communication, what I call social and behavioral change communication. To me, that's the most important thing. Social and behavioral change communication package is very, very vital. The next point is that we should involve the people in their treatment. Gone are the days when thou shalt take. It's not prescriptive medicine anymore. It's participative medicine. You have to take into consideration the person, the family as well. And you have to empower the patient that he has to take charge of his disease. Gone are the prescriptive medicine. There are participative diseases. Now, these centers, as I mentioned, that we have about 150,000 centers that have been established. The most important thing is training and retraining. Because as you know, Dr. Sundaram, the retention part of knowledge is very low. So we have to have frequent training programs. The next point is our lifestyle changes. I have tremendous faith in Ayush. Ayurveda, Yoga, Siddha, Unani, and these homeopathy, they have their own places. I'm not talking of mixopathy, no. I'm talking of it as a package. In this, yoga is important part of the preventive medicine. Yogasana. Second is meditation. You should bring meditation as a part of real life because there's so much of stress in your life that we got to spend some time in meditation as well. Third is the laughter. As you know, laughter is the best medicine. Keep laughing. And it doesn't cost you anything. Yeah. Next is your friends and families.
Great.
Today morning, I read a WhatsApp message that if you have 6 friends, you have 60 years, you become 10 years old with 6 friends. So maintain contact with your friends and family. This is what I have to say.
You have given an excellent message to the community, sir, that there is a NCD pandemic and that has to be managed by lifestyle, changes, which we'll have to convey to our common man through these wellness centers that will reduce the incidence of diabetes as well as the complications associated with that.
And also other lifestyle disorders as well, not only diabetes, but hypertension, cardiovascular disease as well.
CVD, COPD, cancer, all lifestyle diseases will definitely come down, sir. Specifically, anything you want to convey to the doctors, how they should advise the dietary habits for the diabetic patients, sir?
I think the first thing is our doctor community should learn to listen.
Yes.
We don't listen to patients what they have to say. So my first important message to my medical community, please learn to listen to what the patient has to say. Learn to listen, number 1. Yep. Number 2, let him be a participant, not a prescriptive. You have to go from prescriptive list to participation. The third thing is Meenakshi.
Yes, sir. Good evening, sir. I'm honored to meet you. Heartiest congratulations, sir. I have heard you in Lighthouse Goa and FSSAI with Shri Pavan Agarwal, sir. When you had interviewed Rita, madam, it was an amazing session and I could spend some 5 minutes with you over dinner and it's a real honor to know you as well as to know Rujuta.
Thank you so much. It's so kind of you to say such nice words. These are sweet words. I can assure you that I won't get diabetes because of that. But 90% of the diabetes management is dependent on the nutrition. 90%, Meenakshi.
I agree, sir. I agree, sir.
So you have a very important place in this whole story. 90% of all diseases, in fact, are caused because of nutrition. So you become a central figure. So nutritionists have an extremely important role in treating not only diabetes, but hypertension, coronary heart disease, COPD, all lifestyle cancer, all lifestyle disorders. Nutrition is a very, very important vital part.
I agree, sir.
And I'm so happy as a member of the National Nutrition Council, we were focusing on this aspect as well.
Yes, sir.
So nutrition is very important.
So we should say it in 3 words, sir. Control, alt, and del. So control weight gain. Alt is alter your food choices and your portion size. And D is delete anything which is refined or anything which is processed.
Very excellent. What a way to communicate. You seem to be a very good communicator. Control, alt, and delete. Very excellent communicator.
Yeah, that can be the, good message that we say. Pass on to our doctors and community on the forthcoming World Diabetic Day on 12th. Dr. Meenakshi.
The important part of Meenakshi's message is so simple.
Yes, yes.
She has done it in a beautiful way. Control, alt, and delete. Because even a 1-year child knows now what is control, alt, and delete. Social media widespread. There's a pandemic of social media also as well. Yeah. There are a lot of pandemics taking place in our life. The pandemic of social media, control, alt, delete. Even 1-year child would know about it. And actually, that's an excellent message that you are conveying.
Thank you so much, sir.
Dr. Meenakshi, before we close down, can you just give some dietary, clues or tips to a patient with diabetes, overly controlled with multiple systemic complications? has a dyslipidemia, has a hypertension, has a little uremia, has a cardiac event. This is what we commonly see in our day-to-day practice as clinicians, physicians, we see. And then Dr. Chandrakant wants to say
Yes,
something.
sir wants to say something.
To him, and then
I
you
want to say that we have recently started a center in New Delhi called Integrative Global Health and Wellness Center. And we are using rainbow cold laser therapy and stem cell therapy. What we have done is we have included all the disciplines of medicine, not only allopathy, homeopathy, naturopathy, acupressure, acupuncture, music therapy, dance therapy, marma therapy. So the important thing is the rainbow cold laser therapy takes care of diabetes complications, especially neuropathy. I just wanted to bring this to your notice. We started this center only a month back, 2nd of October. It was inaugurated by Maneka Gandhi and Bhaiya Joshi.
Sir, nutrition is also part of the center?
Very important part, very important. Manjari Chandra is also center. Manjari, you know Manjari very well. She is part of our team.
I think government is working straight through, with the Eat Right movement and with NetProfan. I think the first time all the associations have got together to fight for the common goal.
That's right. Nani Palkiwala, the noted jurist, said, we Indians are excellent solo players, but we make a very poor orchestra. Now we got a very good orchestra. The players are working together and playing instruments in harmony. So we got a beautiful music that is being played.
That's great. That's great. What message you like to give, sir, Dr. Chandrakant, for the World Diabetic Day on the dietary side to the diabetic patients?
Be regular in your diet. Most important is keep a close watch on what you eat, when you eat, where you eat, and how much you eat. To me, that's the most important message. Then you can lead full life despite diabetes. Full life you can lead despite diabetes. So basically, frequent, regular checkup of your hemoglobin levels, hemoglobin A1C, but also serum insulin you have to check. Second is be very specific and disciplined about what you eat, how you eat it, where you eat it, and when you eat it. To me, this is the single most important message I want to give on this day.
Thank you, sir. Thank you. Dr. Meenakshi, what do you like to convey to patients?
Sir, I would say only one thing is, always we've been mentioned 3 words. One is variety. You should choose on the right variety. There may be a variety of food. You may have, as you very rightly said, you can have butter naan, you can have tandoori roti, you can have a fulka. You have to choose which one you want to eat as a major portion of your plate. And one important message for all the persons with diabetes, all the PWDs, is never eat a fruit along with their meal. I tell them only simple. If your fasting is a 100 rupee ka note or 100 rupees note, plus or minus 20, you can take a fruit. If your postprandial is 150 rupees note, then plus or minus 20, you can eat a fruit. And at the same time, if your sugar goes below 50, plus or minus 20, then you understand that it is low blood sugar. The whole world harps around hyperglycemia. But I have seen a lot of middle-aged women, they lose or they walk into metabolic encephalopathy because of hypoglycemia. Lot of type 2 patients lose their jobs because of hypoglycemia. And one important message for all the type 1s, we should, the government puts lot of notifications that the school should follow during exam time for type 1s. But how much really reaches the school and how much really reaches the student community? There are so many students who drop out from school just because they are not being allowed to take a snack or carry insulin along with them. No school wants to take responsibility for a type 1 child. So I think these are certain important areas which we need to highlight. Apart from that, so first is variety. Choose on the right variety of food which you want to consume. Second is a balance. You should have a balance in your portion control. Third is the timing of the meal. It's important to choose on the meal timing along with the OHA or the insulin which the patient is consuming. You cannot have erratic meal timings and erratic insulin or, simple. I've seen patients who've had metabolic, metformin associated diarrhea. Patients do not communicate it with the doctor. They tell that if I tell the doctor I have stopped my metformin, I have seen so many. Though the textbook says the percentage of metformin-induced diarrhea may be less, but I've seen several patients not compliant with their medication. Because of metformin-induced diarrhea, they leave metformin or they are not consistent with their drug. And when they lose their drug, there is hyperglycemia-associated complications. So it's important to have a meal timing, variety and balance in whatever you choose and eat on time. That's important. And as Sir said, not only a doctor needs to be a listener, equally a dietitian also has to be a patient listener. Unless she understands what the patient is going through in terms of symptoms, food intolerance, food allergy, or barriers towards following the diet prescription, she cannot achieve the goal.
Thank you so much for the time spent. Then the World Diabetic Day message to our patients will be: diet is the key factor to control diabetes, revert diabetes, prevent the complication, and improve the lifetime of the patient. And we should always, as doctors, we should listen to patients, and we should always give time for the patient to talk, and always put the patient on his choices. For the patient side, always keep your carbohydrate low and no alcohol. Increase your fiber and protein aspects of it.
And no fat diets.
No fat diets. There are any number of paleo diets available. Let us not.
Only balanced diets with a portion control. That's it.
This will definitely give an adequate control of our diabetic patient. With all, let us all close with all your, blessings for our diabetic patients. Thank you all very much. Thank you all very much.
Thank you, sir.
Thank you. Thank you.
RTS, congratulations once again, sir.
Thank you. Thank you very much. Thank you.
Thank you, sir. We'll
Thank you,
definitely. I'll see you.
Thank you for the opportunity, Dr. Sundaram.
Meenakshi, you are not
Hanji,
only
sir.
you are not only become a silversmith or a goldsmith, you are a wordsmith. I like the use of the word PWD, patients with diabetes. It's Public Works Department. It's also PWD.
Yes, sir. Person with diabetes. I don't feel like calling them diabetic. It's unfair. So it's better to call them a person with diabetes.
I like that very much. I think your use of control or delete and PWD is very important. And once in a while we should celebrate. Don't be so religious about it. Once in a while to celebrate.
Yes, sir. Surely, sir.
Thank you, doctor.
Delhi आके मिलेंगे sir आपको. Thank you, sir. Thank you so much, sir. Thank you, Dr. Aluraj, sir. And give my regards to Dr. Aarti Kannan also, sir. Thank you, sir.
Sure.
Thank you, madam. Thank you.